Currently, some rehabilitation hospitals are promoting blood purification treatments that claim to reduce uric acid and cholesterol levels in just one session, with before and after test results to prove it. What is the underlying mechanism of these treatments, and are there any potential side effects or risks involved? To be honest, I'm not very clear on the exact mechanism of these blood purification systems, as I'm not familiar with their operation. However, there are generally two main approaches. Physical filtration, similar to dialysis. Blood is drawn out of the body, then passed through a filter to remove substances like lipids, cholesterol, uric acid, and other toxins. This is a physical treatment method. The risks are somewhat lower, but during the blood extraction and purification process, there is a possibility of secondary contamination, which poses a potential risk. Chemical treatment inside the blood. This involves injecting chemical drugs into the bloodstream that react with uric acid, cholesterol, or other substances, causing a chemical reaction to neutralize or break them down. If you remember from chemistry classes, it's like a chemical equation where certain reactants produce new products. If this method is used, whether by intravenous injection or oral medication, the risks might be higher because it doesn't physically remove the waste from the blood. Instead, the chemical reactions produce byproducts that may remain in the body and ultimately need to be metabolized and excreted by the liver and kidneys. If drugs are used to neutralize substances like uric acid and cholesterol in our bodies through chemical reactions, new substances will inevitably be produced. It's similar to how diabetes medications work. These drugs chemically break down sugar in the blood, but the sugar is converted into other substances. Some of these byproducts can become toxins or waste materials that should not remain in our bloodstream. These substances then enter the liver and kidneys for metabolism and excretion, which can put stress on these organs. This is why long-term use of diabetes medication may eventually lead to complications such as liver and kidney failure or heart and lung problems. Additionally, some waste and toxins in the blood can settle in the lower parts of the body due to gravity, especially in the feet and legs. Mild blockages can cause varicose veins in the legs and head, while severe blockages can lead to conditions like diabetic foot. The feet are the farthest from the heart, so when arterial blood cannot reach them properly, or venous blood cannot return due to blockages, symptoms develop in stages, from feeling cold and numb to skin discoloration and eventually to skin ulcers. Diabetic foot ulcers are particularly dangerous because small wounds or insect bites may not heal, leading to severe infection and even exposure of bone. If you want to learn more, you can search for diabetic foot images, but be warned they can be distressing. Therefore, using chemical drugs to cleanse the blood carries significant risks because chemical residues and byproducts accumulate. According to the law of conservation of energy and matter, the substances formed after chemical reactions may not be uric acid or cholesterol anymore, but they can still be harmful toxins or waste. Accumulation of these residues increases the burden on the body. That's why it's crucial to understand the mechanism behind any advanced technique, treatment, or drug. When you grasp the underlying principles, you can better evaluate whether it might harm your body. The reason why quick-fix treatments that rapidly normalize abnormal health indicators are so popular today is because many people have misunderstandings about health. A common misconception is that as long as their test numbers, like blood pressure, blood, cholesterol, or uric acid, are within normal ranges, they are healthy. Many people focus solely on these health markers daily. If their numbers are normal, even if they have poor appetite, insomnia, cold hands and feet, or general discomfort, they still consider themselves healthy. On the other hand, some people may meet most health standards and appear normal overall, but have slightly elevated blood pressure or blood sugar. These individuals often believe they are ill and feel the need to take medications continuously to lower their blood pressure, blood sugar, or cholesterol. At first, none of us really understood what blood lipids were. Later, it was said that high blood lipids could lead to the three highs: high blood pressure, high blood sugar, and high cholesterol, which in turn could cause coronary artery sclerosis, coronary heart disease, and even stroke. Because of this, many people came to believe that blood lipids and cholesterol were bad. However, recent medical studies suggest that higher cholesterol might actually have some protective effects, such as a lower risk of certain cancers. It's important to understand that medicine and science represent our current understanding of health and disease, but they do not represent absolute truth. Science is always evolving, and humans still know very little about the true nature of the world. For example, scientists estimate that the universe we can observe with our eyes or instruments accounts for less than 4% of the entire cosmos. The other 96% remains unknown to us. There is so much about this world that we don't yet understand. True science begins with hypotheses and proceeds through continuous testing and validation. It is a process, not a final answer. That means all the latest discoveries and inventions you hear about may not necessarily be fully correct. Regarding these blood purification treatments, I honestly don't fully understand their exact mechanisms. If you are considering such treatments, I strongly suggest you first research and understand how they claim to lower substances like uric acid and cholesterol in the blood. More importantly, it's not just about finding a way to reduce these indicators. You need to ask yourself, why are your blood markers higher than others? What is the root cause? Think carefully about the origins of your problem. Could it be your lifestyle habits, diet, or medication usage? Only by addressing these root causes can you find a true and lasting solution.